Hi, it's Dr. Tim. In this video, we're going to talk about breast augmentation. We'll quickly cover what it is, how it works, and what you can expect during the recovery process. Breast augmentation has become the most popular cosmetic surgery in the country. Implants can be made of saline or silicone, and they can be placed in various different positions in relation to your chest muscle. A few different incision locations can be used as well. Smooth, round breast implants have never been safer than they are now. The latest 5th generation technology has given us soft silicone implants that are cohesive, like a gummy bear. Silicone implants have less wrinkling and tend to feel more like your own breasts. The other option is the saline implant. Saline and silicone implants share the same outer shell, but saline implants are filled with salt water. One of the benefits of a saline implant is that it can be placed through a slightly smaller incision, but with modern no-touch techniques, all incisions for breast augmentation are less than 2 inches in length. During your consultation, we will examine your breasts, take measurements, and use a breast implant sizing system in order to ensure that the implant you choose fits you and your goals. Cup size has almost nothing to do with implant size. The number of cc's that someone else got, unless it's your twin, has nothing to do with the size of your breast implant. Once you've decided on the material and the size of the implant, now what? The implant can go over or under the chest muscle. Under the muscle is a particularly good option if you are very thin. The extra muscle over your implant will improve the natural appearance of your breasts and reduce risk of implant ripples being seen. With very rare exceptions, active patients that perform heavy chest exercises may be a candidate for an implant in front of the muscle in order to ensure that the implant doesn't move with chest muscle exercises. Let's check out a couple of case studies. This young lady came in interested in a breast augmentation. When we discussed what her goals were, she desired a more augmented appearance with nice cleavage and some really nice rounded fullness in her upper breast. She's 5'5", weighs about 120 pounds, and we landed on a 420cc implant. The size fit her chest wall very nicely, gave her some beautiful cleavage and upper roundness in her breast. This young lady is an interesting case because of the dimensions of her breast. What you see in the before photo is that she had a very short distance between the lower breast fold and the nipple. She required some modification to that fold to be able to fit the implant that she chose. Here at 3 months, you can see in her after photo that she's retained some beautiful cleavage, upper breast fullness, and that there are no signs of where that lower fold had been. All you see is that she has excellent symmetry, close cleavage, and some beautiful upper breast fullness. This is an outpatient procedure. During your procedure, we like to use a pain block that lasts for about 2 to 3 days. You will need someone to drive you on the day of surgery. Many patients find that they can return to work after a weekend, but it depends on your job. You may return to cardio in 2 weeks, heavy lifting in 4, and bench press type activities in about 8 weeks. If you're considering a breast augmentation, we'd be happy to meet with you and create your unique plan. We look forward to meeting you.